Many of us need to take medication. Some of us, especially older people, can take multiple pills or more every single day. It can be an overwhelming workload for doctors and pharmacists to track all of their patients' prescriptions, according to Dr. Lisa Rottenstein, a primary care provider who used to work at Brigham and Women's Hospital here in Boston.
These are people who are in our daily lives. Many of the people who we interact with on a day-to-day basis likely have more chronic conditions than we realize and are on many medications.
She is leading a study now at Brigham testing how artificial intelligence might be able to lend a hand.
The ideal is actually to be able to have a holistic view of their care and to be able to advance their care even when they are not physically in front of you in the clinic, which is certainly not possible to do in a one-by-one medication list review approach.
That's where FeelBetter comes in. Established in Israel in 2018 and now partnering with Brigham to bring their AI pharmacy management tech to patients in a trial. FeelBetter analyzes patients' medication lists, scanning for potentially problematic combinations and opportunities to streamline treatment.
To scale the work of clinical pharmacists and physicians and to make them as a super clinical pharmacists and super physicians, to be able to see the whole population, to be able to see much more in the time that is given.
The AI will recommend interventions for the highest risk patients, which are then reviewed by a care team. The care team tells the patient about the medication changes if they determine the AI's recommendations are appropriate.
Making sure that things are appropriate and they're not having unwanted interactions. For example, when you take multiple medications together, they can make you dizzy, they can make you confused. And so it will ultimately help patients by ensuring that they are on the right regimen.
The AI tool setting out to help providers extend their care far beyond what's possible for one person and keep those most at risk out of the hospital.
In the end, the purpose is to make the life of people that have complex chronic disease and medication have a better quality of life. And I think that it's important in every day that I'm waking up is to remember what is it for.
The ongoing study will eventually enroll about 450 patients at Brigham's Phyllis Gen Center for Primary Care. I'm Matt Fortin.